Now, talking about opening of schools, a lot is being said about whether this is the time to reopen schools. Offline classes in Karnataka, for example, have resumed after 18 months, and children will be back in Telangana schools from the 1st of September. Here's a report on what different states are now planning to do.
India's active COVID-19 cases are at the lowest in over 150 days. The steady decline in infections has prompted many states to finally call for opening of schools. With masks, thermal screening and other strict SOPs in place, children in many parts of the country have already ditched the screen for in-person classes. Several other states are keen on emulating from them. States that welcomed kids back to school this month include Andhra Pradesh, Bihar, Uttarakhand, Maharashtra and Punjab. Uttar Pradesh, that was all set to reopen schools on August 23rd, has postponed it indefinitely. Karnataka reopened schools in districts with less than 2% COVID-19 positivity rate on Monday. Karnataka Chief Minister Basavaraj Bommai visited a school in Bengaluru that saw an underwhelming 38% attendance.
The schools have started, children are happy, teachers are happy. I have asked them to take care of their COVID norms and health, and I wish them all the best. Knowledge is very important.
Kerala and West Bengal are among the states yet to reopen schools. In the absence of a vaccine for kids, parents are a worried lot. Zydus Cadilla's Zycovid-D, India's first vaccine for children, gives parents hope.
गवर्नमेंट से और सीएम से यही अपेक्षा रहेगी कि उन्होंने जल्द से जल्द इसको हर सेंटर पे देना चाहिए और उनका वैक्सीनेशन शुरू करना चाहिए ताकि आगे किसी भी तरीके का कोई लॉस ना हो सके।
थर्ड वेव में अगर बच्चों को वैक्सीन आ गया है थर्ड वेव के लिए तो कोरोना ना हो, इसके लिए तो हमें ऐसा लगता है कि बच्चों को ये वैक्सीन लेना ही चाहिए और सभी पेरेंट्स ने इसके ऊपर ध्यान देना चाहिए।
The roadmap for school reopening comes even as fears of infections among kids is looming large. In Karnataka, 242 children were infected in August first week when schools were opened. Himachal Pradesh saw 62 such infections. In Punjab, 27 kids were infected till mid-August. Experts, however, assure that there is no evidence so far to suggest COVID leads to serious disease among children. Bureau Report, India Today.
A vaccine for children above the age of 12 has got an approval in India now. But this vaccine will not be given to healthy children in the country just yet. What is the plan then for the rollout of this vaccine for children without comorbidities and with comorbidities? The head of India's Vaccine Advisory Group explains in this report.
There has been significant movement on vaccines that have been developed in India for children. Although the rollout for healthy kids will not be before March next year. Zycovid-D has got approval for use in children between the ages of 12 to 17. Zydus Cadila, the company that had developed the world's first DNA vaccine against COVID-19, intends to bring this vaccine for the younger population also.
We are in discussions with the regulators and the SEC to see how do we move forward in the future with creating a 2-dose regimen also. We will also at the same time now start building for a trial for the children between the ages of 3 and 12. We will now file for the trial permission for the children younger than that also in the next maybe 7 to 10 days.
US pharma giant Johnson & Johnson has moved an application to the Central Drug Standard Control Organization in India seeking permission to conduct clinical trials of its single-shot Janssen vaccine against COVID-19 on adolescents aged 12 to 17 years. Here is what we know about other vaccines in the pipeline. Bharat Biotech's indigenous Covaxin. Its phase 2 and 3 trials are underway and data is likely to be out by September. After which, the company will apply for approval, which at the earliest will come by September end. The nasal version of the vaccine also involves children as volunteers, and at present it has got a nod for phase 2 and phase 3 trials in India. The process may be complete by September. Covovax for kids will be launched in early 2022. The manufacturers of the vaccine in India, Serum Institute, says it has got permission to carry out trials.
The vaccine is likely to be rolled out in October, first week of October. And over next coming few weeks, we will prepare this list, and the state governments and the overall immunization system will prepare itself so that there is no difficulty for parents to bring their children and get them immunized.
Foreign vaccines like Pfizer and Moderna used in kids above the age of 12 outside India could be other options. But there has been no view taken on their import till now. Bureau Report, India Today.
Kerala is at the center of India's COVID yet again. The state's COVID numbers are surging in the week following Onam festivities, and the administration has come under pressure for failing to control the situation. Take a look at this report.
Onam is to Kerala what Diwali is to Delhi. The state which gave the festival the go-by last year, this time opened up and celebrated big time. A week later, the aftermath is there to see. The state reported over 30,000 cases on Thursday, with the test positivity ratio above 18%. Kerala is the only state in the country with over 1 lakh active COVID cases. It contributed over 60% of the cases in the country on Thursday. The Union Health Ministry says the state must increase testing and tracing to get a grip on the situation.
टेस्ट्स जो हो रहे हैं केरल में उनकी संख्या को और बढ़ाने की आवश्यकता है, और इन टेस्ट्स में जो लोग पॉजिटिव पाए जाते हैं उनके कॉन्टैक्ट ट्रेसिंग को और प्रभावी बनाने की आवश्यकता है. बेटर एंड इफेक्टिव मॉनिटरिंग ऑफ पीपल हु आर इन होम आइसोलेशन. व्हाई? Because more than 80% of people are in home isolation in the state. So therefore, festivals have to be celebrated with COVID appropriate behavior.
The saving grace experts in Kerala say is that hospitals are taking the load. But now the stress is starting to show. 38% of the ICU beds are vacant and 37% of the ventilators are available.
Increase the total number of vaccination in the coming days, and if the hospital admissions are under control, this surge also can be managed easily.
Kerala Health Minister Veena George has blamed the higher numbers on improper isolation of patients at home.
We are closely monitoring the situation, and our government of Kerala is dedicated to protect the lives and also the livelihood. When you look at the fatality rate, we have one of the lowest fatality rates in the country, around 0.5%.
The surge in Kerala has sparked a political row, with both Congress and BJP targeting the left government.
An extremely unfortunate and negative development by a government that has been elected on a platform of being the people's government. That Kerala is in the ICU, and before it gets carried away in an ambulance, the government needs to take better action.
Government of Kerala said that we are introducing the home quarantine, which has miserably failed. So with such a good health infrastructure, if the government is not able to perform, it shows that the government doesn't have the capacity. Government is ineffective.
Kerala is at a critical juncture in its fight against COVID-19 pandemic. The state is betting on its high vaccination coverage to avoid serious illnesses among those infected by the virus. But if the cases continues to rise, the state's health infrastructure could well be compromised. With camera person Vishnu, Gopikrishnan Unithan in Thiruvananthapuram for India Today.
Well, the latest spike in daily infections in the state of Kerala come after the Onam celebrations. The state is reporting over 30,000 cases in the last 24 hours. This is the highest that Kerala has witnessed since the month of May. Look at the trajectory of the cases here in the state of Kerala. We also reached 31,000 cases and the last 24 hours is at 30,000 also. Talking about the positivity rate, it's reached a frightening level of 17.3%. Let's now take a look at a comparison between India's data with that of Kerala. How was the state really performing? First, let's talk about the tests. The test conducted per lakh in Kerala is 87,172. Look at the national picture. 38,500 on an average in the country. So the state is doing much better. Interestingly, in the sense that it's doing more tests. Well, COVID cases per lakh in Kerala is 11,056. India overall is 2,443. Certainly better detection in Kerala. The positivity rate to India's now in the country is 1.9% on an average. Kerala at a disturbing 17.3%, which roughly means that 17 people testing positive for every 100 tests that have been done. The death ratio in Kerala at 0.5%. In India overall at 1.3%. The central government has continuously said Kerala model in terms of the death ratio, keeping the deaths low, is the model to follow. Well, the active ratio in Kerala right now is 4.4%, while in India is 1%. Joining me now is the Health Minister of Kerala, Veena George. Thank you for your time, Veena George. The state, of course, is news for the wrong reasons, but questions have been raised about relaxation allowed during Bakri Eid and now Onam, which has possibly led to the surge. Should the government have not done a rethink on relaxations?
See, we are closely monitoring the situation, and our government of Kerala is dedicated to protect the lives and also the livelihood. When you look at the fatality rate, we have one of the lowest fatality rates in the country, around 0.5%. So, and also it has been 1 year and 8 months since the first case was reported in the country. It was reported in Kerala. The first case was reported here. So we cannot keep the people all the time shut down in their houses. So we have to protect their lives and also their livelihood. But the most important thing is that we are asking our people to have COVID appropriate behaviors. You can see everywhere in Kerala, the people, they are wearing a mask, they are observing social distancing, and we are not allowing social gatherings with large crowds. Only less than 20 people are allowed in wedding ceremonies and also in funerals. And also, we do have DCCs, domiciliary care centers, to avoid home clustering. And we are closely monitoring the situation. And since the vulnerability or susceptibility of the state is high, again, it shows the success of the protective measures so far we have adopted. So, since the vulnerability or susceptibility is high, more chances are there. And also, the second wave started by the middle of April. And we have always tried to drag the wave to delay the peak. So we had a peak on May 12th. On a single day, on May 12th, we had more than 43,500 cases. And then if you look at the number of cases, it went on decreasing.
All right. Veena George, thank you for your time, and thank you for, in fact, joining us with the latest as far as the Kerala situation is concerned. The government is saying that they've done all that they can. The situation, they say, in fact, is still under control. The state government has, of course, said that vaccination needs to be improved in the state of Kerala. With that, it's time for a quick commercial break here.